Ann Turner, the Clinical Director for Integrated Healthcare for Network for Health. And
I'm Megan Spencer, the Program Manager for Integrated Care for Network for Health.
And we both attack this integrated healthcare project to hopefully improve the healthcare delivery system in our region and also share best practices with our other counterparts across the state. Basically, to break this down into buckets, we look at the who, what, where, when, why, and then the how. And the how's the difficult and important piece. The who is the person, so the patient or client that comes into a behavioral health or primary care setting.
Or a community-based organization.
If they are at risk or have a behavioral health condition, we want to make sure that they're getting that appropriate care and that people talk to the behavioral health side and community-based services to address those needs. Also on the behavioral health side, if somebody has a chronic condition like hypertension or diabetes and they're not being followed by their primary care, then the behavioral health team would connect with the primary care team.
And that all of those organizations are connecting with all of the wonderful community-based support organizations that we have. To make sure that everyone's getting what they need.
Part of what this project does is to address 12 different domains so that we're not overlooking something in somebody's health and wellness. So we're looking at everything from housing security, food security, jobs,
transportation,
legal,
yes,
dental,
your full medical review, questions about your use of substances,
and sense of isolation, what you're able to do, your activities of daily life. So do you need help doing those things? They will set up their offices to have the staff to support all of this. When we look at the when, we want it to happen in a real timely manner so that these things can have what we call warm handoffs, where people are actually connecting the person or family to the right organization to set up that follow-up appointment or follow-up care.
So we want you to be able to receive care in the location that you're most comfortable. So whether that be within your primary care office or with your behavioral health provider, and be able to connect you with all of the services you need in a location that is comfortable for the client.
And the why is because it's the right thing to do. Along with doing the right thing, you also get the benefits of having it be a more efficient, effective system that has better outcomes, both financially and for the person. So the more important thing is
getting the right care at the right time in a place where you're comfortable.
The how breaks down into a lot of different arenas, but basically we address people, workflows, processes, and also we look at what the enabling technology is to support all of this. So when things can be automated, a lot of times you decrease the risk of mistakes happening. You make things happen more efficiently and make it more user-friendly, really, for the person and the provider and their teams. We look at multidisciplinary teams, having standardized screenings and actions, creating shared or coordinated care plans between the different provider settings and community-based organizations so that everybody's talking about the person and really trying to address all the different needs. People who are particularly complex and need extra attention, there would be case reviews that would involve the teams on both sides.
Making sure that your providers all know the services that you need and making sure that those services are being engaged on your behalf, and so that everyone who is part of your treatment team knows what the patient needs.
Underlying all of this is that everything needs to be evidence-based, so that we're following national guidelines, evidence-based practices, sharing them among our different partners. We have over 40 partners in our region, the Manchester-Dairy-Salem region.
There's multiple ways of doing integration. There's multiple models that are going on across the country, and our goal is to allow our partners to test these different models and see what works best for our patients and our region.